everyone, and welcome to Service World Podcast, where we will educate, empower, and equip you with the knowledge that can save lives. Today, we are going to be talking about emergency situations that can occur at home, at school, at your working place, and that's first aid basis. I have a very distinguished guest today that will be handling us on that topic. By my left, I have.
I'm in the teaching environment. Registered as a emergency.
Well, nice to have you around. By my right, we have.
So my Elizabeth, I'm a student nurse.
Wow, thank you so much for honoring my invitation to be part of this podcast today. Can you explain first aid for us in a very clear simple way?
Okay, in a layman's language, we say that first aid is the first treatment given to an injured or a life-threatening individual prior to presentation.
Wow, thank you, sir. Oh, now please, is this first aid actually important?
Of course it is. First aid can prevent situations from getting worse. It can reduce pain and it can even save a life.
Wow. So since you have now gotten the knowledge of first aid and how important it is, I believe we should dive into some emergency situations that can occur at any given time. Such emergencies can be, let's say, burns, which can be caused by electric heat or anything at all that can cause damage to your skin. So, sir, I want to know, during emergency situations whereby you have burns, what can we do at that point?
Okay, in any given emergency situation, the safety of the rescuer comes first. In the sense that you that is saving a life, your safety should come first. First of all, you take this individual out for harm first. If it's a fire outbreak, the individual is meant to be taken out from the fire outbreak. Then our emergency response, we have the ABCs, the airway breathing and the sequences. These are what you should also put into place to intervene in emergencies.
Wow. Thank you so much, sir, for that. So we need to try ABCs so that we can know what else. Okay, Nurse Elizabeth, I want to know at what point can we start taking these patients to the hospital?
Okay. So when the bone is so deep, it has a large, like it affected the large area of the skin. When it affects the face, the genitals, or the bone was caused by an electricity, you can actually refer the person to the hospital.
So please, in case you should have a case where your skin is being burnt and you know you cannot handle it again, please, after your emergency approach, try, in fact, do as good as you can to take this patient to the hospital. Okay, now I would like to set another example about this emergency situation. Now, please, let's talk about bleeding for now. Bleeding can be scary. What should we do in case of bleeding?
Okay. So, firstly, we should apply pressure.
Okay.
On that's the bleeding area. It's a clean cloth or bandage. Then you raise the bleeding side if possible. You have to raise it. So then you also keep the pressure, like you have to continue pressing the place so that bleeding can stop.
Okay. We are talking about escape of blood from blood vessels.
Yes, sir.
That's just the summary definition of what or in the medical term, hemorrhage. So now, the first approach is, as she has just said, the first application of pressure, bandages, body pressure dressing. So pressure dressing plays a vital role by constricting the blood vessels. So now, another thing we also need to do, not only the application of the, we need to also check out for if the cuttings are sterile, if the organs are sterile for you to apply. Because it's an open vessel.
Yes, yeah.
So, and also, if the limbs, if it's in the lower limb, then you feel that the blood is superior, you also need to elevate the limbs. Wow. If it's in the arm, there is a need for elevation. So
also, when can we say that this bleeding or hemorrhage is not serious?
Okay, from the times we have mild, moderate, and severe. So in severe, we are talking of excessive bloods that a total human being has in 5 organs. So when someone was close to like 4.5 to 4 organs, that means there is excessive bloods there. Prior to presentation in the hospital, PCV test, budget PCV. So anyone recorded below 2 shall be
okay, that even means that we should try as much as we can after emergency to also bring along the clothes.
Yes. Yeah. In emergency situation, yes. For us to be able to examine or to also know the amount of blood loss, so there is any need of you to carry along the parts, especially for women. Then for the guys, if it's in the hand, the clothing that are being tied, you should also carry it. So this will give us a clear overview of the amount of blood.
Thank you so much, sir. I appreciate for that clarification. Okay, now let's cite another example. Let's look at this case of choking. Nurse Elizabeth, is there any way that we can identify this case of choking? Yes, the children.
Notice when the child is finding it difficult to speak, like trying to grab the throat, then like no sound while trying to cough. You can also notice cyanosis, that's bluish discoloration of the skin.
Okay, sir, I haven't heard about the indications, or let me say the signs and symptoms rather than indication. What are the approaches that one should take concerning this issue of choking?
Okay, one is partial occlusion to the airway. That is what the definition of choking is. When there is obstruction or total complete blockage to the airway. So now, the post approach is for us to go back to our BLMs, where we have our airway and bypass, where we have our jaw lift, head tilt, and abdominal thrust or back slap that can be used in pediatrics. So all these things can be applied. It's a technique.
Wow.
And if you're not good at BLMs, you can't be able to work.
So what if you are branding this case or trying to do these things that you just mentioned, and even the backslap and airway maneuvers, and the patient now becomes unconscious? What should you do?
The first thing is just to trigger your emergency response call, dial your 911 and stay carrying out CPR. Because cardiopulmonary resuscitation should be a vital sign immediately at that particular moment of all responsibilities.
Wow, thank you so much, sir. I believe even if I should have a baby that is choking, I can do some practices like the backslap.
Yes. If you know the techniques, yes. Not hearing a backslap, then you're snapping.
It is alright, sir. Thank you so much. I would also like to talk about the issue of fainting or syncope, as we call it in medical lines. And I know that this fainting can be caused by either stress, heat, low blood sugar. So, sir, at this case, when this thing happens or if someone slumps, what should be our approach?
Okay. Once we are talking about syncoping or in a layman's language faint, we are talking about operation in the CNS that's being built about by shock. So now, if there is a syncope, immediately the person becomes unresponsive. What you just need to do is to check for immediate cause of that syncope immediately. Then, if it's something that relates to an age, the first thing you should also do is to take that individual out from that environment where that allergic reaction is. And also, the next thing also, if the unresponsiveness becomes severe as the duration keeps migrating, keeps spiking, then you heat up your medicine response for blindness.
Wow, that's
yeah, and please, in addition, you guys should not pour water on the unconscious patients. Do not pour water or force them to take water. Don't force them, please. if the person doesn't gain consciousness within 1 to 2 minutes, you have to seek for help.
Wow. Okay. Now, since you have heard about this, I want to ask this a quick fire round questions. Sir, should we apply toothpaste during burns?
Okay, no, knowing fully well that it's an exploration of the epithelial cells or the epidermis of the skin. The skin is now being exposed, and you know that some of our toothpaste have some kind of chemicals that can be allergic to the skin also. Then I have seen a situation where people advise you to go with raw eggs, knowing fully well that these eggs can still have microbes that can predispose these individuals to sepsis. So it's not good either to use even down to leaves or eggs, raw eggs or toothpaste. No, it's just to keep it sterile.
So having had that, I believe we should learn our lessons in it. So now, Nurse Stacy, is there need for us to panic when we have an emergency situation?
I would say no, you don't have to panic so that you don't make mistakes. You just have to stay calm.
That's the should hospitals be replaced with this emergency acts?
No, it's just a temporary help. First aid is just a temporary help that you should do to prevent the case from worsening before going to the hospital.
Wow. Thank you so much about this, your explanations. Honestly, I believe our audience have had enough lesson. They have gained a good knowledge so that even if they should encounter such thing, they can be able to know what to do and it's safe their life. So sir, I would like to know, is there any final word of advice that you can give to our audience?
Yeah, the final word of advice is I want to talk to the government directly because now the government needs to make policies down to the curriculums of the primary to the secondary, how to make use of BLS. If BLS, that's basic life support, if it's being added to the curriculum, it will help to prevent some kind of emergencies and also to help bring about medical education.
Wow, thank you sir, thank you so much. No, Stacy, we would like to also to hear from you.
Okay. Please, you just have to stay calm during emergency situation. You don't need to panic. You don't have to panic at all. Then you heard Miss ABC talking about the CPR, backslapping and all of that. If you are not trained, please do not do that. If you are not trained, do not do that so you don't cause problems.
Thank you so much. Our amiable audience, I believe you have learned a lot today. I believe you have gained. Thank you so much for your audience today, my amiable viewers. I believe you have been able to get a good knowledge about this ed management. Please, if in case you have not subscribed yet, do well to subscribe, like and share. I remain your honorable host, Nurse Salvation. Bye.